In your medical news today, children with mental health disorders often aren't getting the help they need. A new study finds just 11% of young people with serious mental health issues like depression and anxiety received a diagnosis, and less than half were accepted to receive help from mental health services. Researchers say they've discovered which policies are most effective at reducing suicide. A study found gun laws requiring waiting periods and safe firearm storage helped prevent suicides. Additionally, public policies like minimum wage laws, paid sick leave, unemployment benefits, and access to mental health services also contributed to a lower suicide rate. If you're drinking coffee right now, here's when you might want to make it your last cup. New research shows morning coffee drinkers have lower risks of heart disease and death compared to all-day coffee drinkers. The key is the timing. Those afternoon lattes could be disrupting your body's natural sleep cycle. Making cheerleading safer is the mission of one brain surgeon. Stephanie Stahl has more on the new competition that has just started.
Cheerleading reaching new heights with something called partner stunting, training here at the Tumbling Center in Blackwood, New Jersey. In the middle of the action, a neurosurgeon and her two daughters.
I do a lot of traumatic brain injury research in my actual job, and so people are always asking me, don't you get nervous like seeing them do this?
Dr. Xin Chen says no, she's not overly worried as long as the right precautions are in place.
It's not a sport that should be dangerous if taught and supervised the right way.
The American Academy of Pediatrics says about 3.5 million youngsters, mostly girls, participate in cheerleading. There are an estimated 35,000 injuries each year. 31% are concussions. Dr. Chen is hoping to lower those numbers by spreading awareness about the importance of safety and training.
No sport is going to be 100% safe.
Statistics show cheering is less dangerous than many other sports, but it still carries a risky reputation. Dr. Chen says it's good exercise that can also help build resilience, self-confidence, and camaraderie.
It's no different than any sport, but you have to trust your coach, you have to learn the right way, and you have to make it as safe as possible, or else nobody would do any sports.
Dr. Chen knows all about taking on difficult challenges, being among just 8% of women who are brain surgeons. And now she's on a new mission, creating the Stunt Showdown, a competition for young athletes to showcase their skills with proceeds going to charity.
The American Academy of Pediatrics says coaches, athletes, and parents in cheer programs should learn the signs and symptoms of concussion and how to seek care for athletes.